So if you're ready, we can start.
Yes, ma'am. Can I start?
Yes, you can start.
Hello, good evening.
Good evening.
I am Dr. Irene, one of the attending doctor here today. Am I talking to Mr. Harrison,
Yes, doctor, I'm Mrs. Harrison.
58-year-old?
Yes, I am.
So, Mr. Harrison, I'm here to discuss regarding your health issue. Also, I'll take some notes which will be highly confidential. Is that okay with you?
Yes, doctor, it's fine with me.
So, Mr. Harrison, can you tell me what brings you here today?
Doctor, I'm having some trouble walking and now I'm having some frequent falls.
I'm really sorry to hear that. So, you having this trouble in walking, right? For how
Yes.
long it is?
Difficulty in walking I'm having for the last 3 months and I'm having these frequent falls for the last 3 weeks.
Okay, so do you notice that this fall along with this due to difficulty of walking?
Yes, I think, doctor, it is due to this because 2 times I just tripped over the carpet and I fell down.
Okay, so this difficulty of walking, this how it progressing is the same you feeling or it is progressing worsening,
No, it's worsening day by day.
worsening day by day. And do you notice that is it started suddenly or gradually?
Gradually, doctor.
And any episode do you feel that you having difficulty of walking due to weakness over your limb?
Yes, you're right. I feel that my legs are weak.
And do you notice any pain around your limb? Anything, any type, any pain?
No,
Sorry.
no, no pain, no pain.
And is okay. Do you notice that if along with this fall, any type of loss of consciousness?
No, never.
And anything? Do you notice that this walking difficulty increase any aggravating factor that any headache, any weakness related to this walking difficulty? Anything? Do you notice? Any
Anything aggravating
you
it?
notice yeah any factor you notice that it difficulty of walking you feeling difficulty more than if you trying to wake up from sitting to standing, any weakness,
No,
any feeling? Yeah, okay.
I
And
just
if
feel
any
weakness. I just feel weakness in my legs. Otherwise, I don't feel dizzy when I get up from the sitting.
okay, so is it a first time that you feeling this difficulty of walking?
Yes, doctors, I told you I'm having this problem for the last 3 months.
Yes, I so it
Before
is
that,
your
I
first
never
time.
had. Yes,
Yeah,
before
I
that, I never had.
okay. Along this fall, and you said you didn't you never loss of consciousness, right?
Yes, I never lost.
Just you fall down and any trauma you have along this fall down, any
Luckily
trauma?
not. Luckily not.
Okay. And this weakness as you feel, do you feel that you have any high temperature?
No,
And before 3 months ago, any high temperature, any infection you have,
no,
like
I don't have any
any
infection.
like any cough, any
Yes, doctor.
water work? Okay, tell
Ask
me.
question one by one. Yes,
Okay.
doctor. I don't have any infection, but I have some cough.
Okay, so it started how long ago?
I have this cough for the last, you can say, 4 years now.
4 years. Okay. So, is that cough associated with any productive or sputum? I mean, or dry?
Yes, doctor. I produce phlegm with it. Right. At time, most of the time, you can say always there is some phlegm.
Okay. If I say the amount, is that any spoon or any how much amount of this phlegm?
It varies with time to time.
Exactly. And along this cuff, do you feel that you have any sound, like wheezy sound from your chest?
Yes, sometimes, very rarely.
And do you notice that any chest pain along this cuff?
Yes, doctor, I have some chest pain also.
And this chest pain, what is the nature? Is it increased when you inspiration or any doing work?
Doctor, are you asking me for the nature of the pain?
Yeah, I am asking
Yes,
what is the
doctor,
nature? Hmm.
yes. When it started, it was sharp, but now it is some dull sort of pain.
Okay, but do you notice that when you take breath, it increase the pain?
Yes,
Okay, and if you do work, it is more you feel anytime,
yes,
and if you take rest, it resolve.
no.
And okay, and any difficulty of breathing?
Yes, I become short of breath when I exert or when I go upstairs.
And do you feel this? You have racing of the heartbeat
No.
along this difficulty of breathing. Do you notice that you have to wake up the night due to grasping of the air?
No, doctor. Yes, I wake up at night, but not due to any other problem, just because of this pain.
Mhm. Mr. Harrison, do you notice that any tummy pain,
No,
any tummy discomfort?
no.
Okay. So, apart from you thinking that you have weakness over your limb, is it both limb or anything? What do you think?
Yes, weakness is in both of my legs.
Any other part of the body you have weakness?
No,
Mm. Anything, do you notice your bowel habit, your stool consistency,
it is unchanged, doctor. My bowel is fine.
anything you notice in your water work?
Yes, doctor. I've noticed at times I have lost control of my waterworks.
So, how long it started?
It is for the last 3 weeks.
And Mr. Harrison, this the loss of control of the water work. You notice also you have any control problem in your bowel habit or only water
Yes,
work?
yes. Not with the bubble bugs, just the waterworks.
And also you notice any color change, any
No,
frequency change?
no, no, no.
Mhm. So, Mr. Harrison, when this weakness started over your limb, do you notice any time before any trauma you have, any history of trauma?
No, no,
Hmm. Okay, and any headache? Do you notice
no,
any vision problem?
no.
Any weight change you noticed?
Yes, doctor, I have lost weight.
How many and how long?
Doctor, I have lost 1 stone weight over this 2 months.
So is it was intentional?
No.
Okay. And any loss of appetite?
Yes, at times I don't like to eat food.
And do you have any pain any part of your body?
Yes, this chest pain I'm having.
I mean, any joint pain,
No,
any rash, any part of your body?
no.
Okay. And that you have any past medical history that I should know?
Doctor, I just have this cough I told you for the last 4 years, and for that I take some medicines.
So how is it progressing? Any diagnosis do you know the doctor done?
Yes, I think it's a smoker lung.
Okay. So Apart from this cough, any other medical history that I should know anytime you need admission?
No, no, never. I don't have any other problem.
Any medication you taking nowadays?
Just I tried some paracetamol for this chest pain.
Any family history of note?
No,
Any heart problem? Any sudden death?
no.
Okay. So,
2 minutes
Mr.
are
Harris,
remaining.
any back pain do you have? Any
Not back pain. I told you that I have this chest pain and it goes around my whole of the chest, just like a band.
okay. So, okay, understand. So, Mr. Harrison, as you
Yes.
cough for 4 years and you have a smoker lung, as you said, so do you smoke?
Yes, doctor, I do smoke.
How many and how long?
I smoke more than a pack a day and I'm smoking for the last 40 years.
14.
40.
So, Mr. Harrison, you know smoking is not good for our health. So, you have to think regarding the quitting of the smoking. If you think so, there's a smoking cessation clinic, they'll help you in this regard. Is that okay with you?
Okay, if it is good for me, I will think about it. Thank you.
Uh, do you drink alcohol?
No,
Okay. So, Mr. Harrison, what is your concern?
doctor, is this something serious going on?
I appreciate your feelings, Mr. Harrison. I have to talk to you. I have to do examine to you, but it most probably it is now a serious condition. We have to admit you, and we have to do some investigation, blood test, and imaging test. Do you have some chronic infection over your lung, and you have some weakness that your nerve function not controlling well, and you lost your water work control, and you also losing you also have pain over the chest. It's a infection over also your chest wall covering. Okay, this is called
Okay.
pleuritic chest pain. Don't bother the medical term.
Your time is up, but you may continue.
So most probable
Okay.
diagnosis, it is a complication of a disease. It is called Guillain-Barré syndrome. Don't bother the medical term. But what we will do right now, we'll make multidisciplinary team, brain doctor, nerve doctor, also infection control team, also the heart doctor for evaluation, also lungs doctor. So for further management plan, Mr. Harrison, do you have any other concern?
No, thank you, doctor.
Yeah, you're most welcome, Mr. Harrison. We will meet you again with your report and
Okay,
management plan.
okay, thank you. So, do you want to take 1 minute?
No, no, no.
If you want to take, just rearrange your case if you want. If
Okay,
no, we can
okay.
start.
No, no, it's okay.
Okay. So we will. I have set the timer of 5 minutes for the examiner's question, right? So,
Mm-hmm.
what are your positive finding in this case? And on the basis of that, what are your differentials?
Mr. Harrison, 58-year-old, coming with frequent fall due to weakness of the limb, which started for 3 months and also it's gradually increasing. Also, he has suffered for 4 years. He is productive and which is sound. Also, this Mr. Harrison have theoretic chest pain, sharp, dull in nature, which increases inspiration. And Mr. Harrison also losing control of water work, so most probably that is now ongoing. Mr. It is an acute crisis of the Guillain-Barré syndrome due to his
Okay, and how you fit in this weight loss?
this weight loss goes towards for the malabsorption, but there is no history of the bowel changes, and
Okay.
it
Oh,
could
are
be
there any weight changes in GBS?
there is no weight changes. That is against GPS, but
Mm-hmm.
my most My differential is like it is it be combined. It is the autoimmune. I mean, it's the my other differential is severe combined deficiency of the immune function. It could be, but this is not associated with this type of weakness and multiple sclerosis, motor neuron disease. But I can't correlate with this weight loss, this kind of theoretic chest pain. Severe
Mhm.
combined autoimmunodeficiency, I can't correlate with this weakness.
Okay. So your first differential is GBS and your second one is chronic immunodeficiency syndrome, right? And what is the third one?
It could be multiple sclerosis, though there is no features for the multiple sclerosis. I didn't get any clue for the any change of the vision problem, so it rule out.
So vision problem
Still,
is not always
yes,
necessary to make the
yeah,
diagnosis of the multiple sclerosis.
mm, yes, yes.
Right.
But the
So
weight loss
have you
also, weight
asked
loss also I
have you
can't
asked that
correlate.
whether the weakness the patient was having weakness of leg, whether the legs
Mm.
were floppy or stiff?
I was trying to ask, but how to ask, I forget. That two times I forget. Is it stiff or floppy? Whatever the nature, I
So we will
forget the
ask.
question. Yeah,
Do you feel your legs are stiff or floppy? It's a layman term.
floppy.
Okay, so
Yeah,
his
it's a
legs were
floppy.
stiff.
Uh, Okay, stiff.
Okay,
Okay.
okay. Now, do you have any differential or you want to consider your differential like this? 52. What's the age of the patient?
58.
58. 58-year old Mr. Mark with he's a chronic
Cold.
smoker, right?
Mm-hmm.
And with a
Yes.
history of chronic cough for the chronic productive cough for the last 4 years, and for the last 3 months he is having some difficulty in walking and his legs are stiff. Right now he is having frequent falls for the last 3 weeks, and he has lost he has some urinary incontinence, and he has lost 6 kg weight. 1 stone is 6 kg.
Okay.
Right. Now, do you have
Yeah.
any other differential? And he is having some chest pain that is just like a band and throughout the whole of around the chest.
Yeah. Chest pain. Ghost fever. I was thinking pleuritic chest pain. And regarding.
You asked
Mhm.
me that it increases with breathing, coughing. Yes, it increases with coughing, and it increases on movement, and it increases on sneezing. Okay. So character is initially it was sharp. Now it is a dull pain, and it is so severe that the patient has to get up at night due to the pain. Right?
Uh, yeah. So this sharp pain now dull pain. Is it pleuritic? Uh,
No.
yeah. So
You asked
pericardial
me
bleeding.
any relieving factor. I said no.
Yeah.
So you haven't
Uh,
asked me. So let's have an
mm,
overview of the case, right?
yeah.
Because this is
Yeah.
not the case.
Okay.
Could it be lung malignancy with Mets?
Lung malignancy. The age is not favoring for the lung malignancy.
But he's a chronic smoker for the last 40 years,
Yeah.
right? And he's having. You asked me for do you produce any sputum? Is a jargon, so you will use the word phlegm. Okay.
Cramp.
So
Yes.
is your cough dry or do you produce any phlegm with it?
Mm-hmm.
And whenever the patient is having cough, even if it is dry, we will ask, have you ever coughed up blood? But this patient was having some productive cough, so it is very necessary to ask, have you ever coughed up blood? You missed that question,
Yeah. Cough of
right?
blood. I missed. Yes. Yes. I missed.
Okay, that was important. So how to do the case basically? The initial presented complaint was frequent fall. So you localize that what is the fall, and I told you that it is due to difficulty in walking, and then you localize what do you mean by difficulty in walking? Do you feel weak? I said yes, there is some weakness, and you were going very great.
Mm-hmm.
When you go away from the skiing, things mess up, right?
Mm-hmm.
Here was one question which you missed was the Do you feel that your legs are floppy or stiff? So that was stiff.
Yeah. So it's the upper motor. Mm-hmm.
Yes, upper motor.
Mm-hmm.
You asked me for control of waterworks. Just make the pet questions. Have you noticed any problem with control of bowel works? Whenever there is leg problem, leg weakness, oh, two questions are very necessary. First one is about the backache. The other one is about the control of the bowel works and the waterworks. Backache, you are asked. Normally, the patient take the backache as a lower back pain. This
Mm-hmm.
patient was having central chest pain that was initially sharp and then dull. Pleuritic chest pain does not radiate around the chest. It is basically due to collapse of the vertebra and due to METs.
Mm-hmm. So what,
So you did
ma'am,
not.
regarding this chest pain, lung malignancy, and telling frequently I have chest pain, chest pain. So what is the nature of this chest pain? Dull, aching, all over the chest. So what I will tell it.
There is collapse of the thoracic vertebra, right? So patient
Mhm.
cannot, you can say, the recognize that from where the pain is originating. So initially when there was collapse, it was sharp pain, and then around the whole of the chest, just like a band, means the distribution of that nerve which is being involved. That is a sharp radicular pain or dull
Okay,
pain of the collapse of the vertebra. And that is increasing on coughing, straining, sneezing.
okay.
It means that there is compression. So you miss that stiffness and floppiness there, and then in
Half
such
minute.
history, just do the overview weakness in any other. After completing the analysis of the presenting complaint, you will ask weakness in any other part of the body. Have you lost consciousness? You've asked me two times that have you lost consciousness. Do not repeat the questions. Then just
Mm-hmm.
do the. This is from the nervous system. Just do the review from head to toe. Any headache, any shakiness of any part of the body, any double vision, or any problem with control of waterworks, and she was having urinary incontinence. Okay, in this way, any numbness in any part of the body. In this way, you will do the nervous system and then ask, do you have any other complaint? Or before doing the nervous system question, we can ask, do you have any other complaint? The patient will tell you, yes, I'm having this chest pain. Or when you asked me, do you have any back pain? I said, not back pain. I just have chest pain, but it goes there. And here you just asked me the type of the pain and asked many questions in a system. In one sentence, you asked about the character, aggravating, relieving factor. Make your questions very clear. Okay. First, there is a mnemonic for the pain, that is a location, onset, character, intensity, aggravating, and relieving factor. Right? Location, I
Mm-hmm.
have told you that it's central. Chest pain, onset, character, I told you. Intensity, you haven't asked, and radiation, you haven't asked, but I told you. Aggravating factor, you have asked me, and I told you that I take the painkiller. So offer the painkiller here. Next, I told you, you asked me, do you have any cough? Yes, I told you I have cough. So you'll ask, is it dry or do you produce phlegm? If phlegm, okay, so you quantify the amount, that is fine. Okay, what is the color of the phlegm? I will say that most of the time it's clear, but sometimes it can be yellow. And have you ever coughed up blood? Then comes the any shortness of breath. I have given you the exertional dyspnea. Then you asked me the chest pain, any racing of the heart, and tummy problem you have asked me. Then review of the system was fine. If after doing the presenting complaint, if we keep the general question, so it would be helpful that you know that there is weight change. 1 stone means 6 kg, right? So there was weight change, high body temperature. You asked me two times. Do not repeat. Skin changes you have asked, joint problem you have asked. Okay. If you memorize your scheme, so there would be two benefit. First, it you will not repeat your question. Secondly, it will save your time. And third thing is that you need not to look for the question. Okay. So you will just extract the information that is given by the patient. Then the past history you have asked me, that was fine. And medicine list I have offered you that I take these medicine. You just overlooked that I was taking salbutamol inhaler. Here ask, have you do you take any steroid tablets? Because that can be relevant here, and because that can cause the osteoporosis. Maybe patient is taking steroid and for the long period of time. although this patient was not taking. Okay, then comes the allergy, admissions you have asked, the social history, job you have missed, impact you have asked, so smoking and alcohol history you have taken. Okay, so you have summarized the case very well while presenting, but differential would be cord compression, either secondary to the lung malignancy. Okay, or due to any other cause. Ask for the because this patient is having productive cough with weight loss. So to ask any contact with a TB person, right?
Yeah.
Are you with me?
Yes, yes.
So
But
your clinical
mhm.
is still your clinical your differential diagnosis you have lost. Okay, but your clinical judgment is here is safe because you admitted the patient. It's an emergency. Cord compression is an emergency, and we will do the urgent MRI of the spinal cord.
Yeah. Mhm, yeah.
So as I always say that it is skill based. So you lost just the differential diagnosis skill. Rest,
Yeah.
clinical communication is fine. Clinical judgment is fine. Most of the time, the examiner guide you. Suppose this patient is having, as I have asked you the question that this patient is having this weight loss and these symptoms. Can you think of your any other diagnosis, or do you want to rearrange your differentials? So they offer that, and sometimes they can give you the hint. Suppose this patient is having cord compression. So how you will investigate, right?
Yeah.
So your
Yeah.
rest of the skills are saved.
Okay. Then
So if
here you
you
can, yeah, cord compression was my DD, but regarding still now I didn't keep on my mind malignancy. I didn't keep on mind. It was so many major mistake I done. Yeah.
but that is just for the differential diagnosis. They will give you marks for the clinical communication.
Okay. Yeah.
Okay, they will give you marks for the patient welfare because you have admitted the patient and you have asked to quit the smoking. It is
Mm.
better to offer whenever the patient complains that I am having pain. So offer the painkiller. Do you want any painkillers? And
Mm.
show empathy, right?
Yeah. Okay.